Hello, and welcome back to Sembang Sihat with me, Dr. Deeban, all right, your host for our podcast on all things related to men's health, brought to you by Hemedical Clinic, your one-stop center for all things related to men's health. All right, so we've had two topics so far previously. If you have not watched them, please do so on our social accounts, YouTube, Instagram, TikTok. All right, so the topic for today is premature ejaculation. How premature is premature? All right. So this is a topic that, as a medical professional, as a men's health practitioner, I get this question again many times. Doc, I have premature ejaculation, or doc, I can't last long. So we're gonna dive into this topic, discuss a lot more about it. And to join me on this discussion, I have again two of my favorite panelists, Dr. Praha, my colleague from Hemedical Clinic.
Hi,
and
Deeban.
hi Praha. And Dr. Vaishni, again, female health
Deeban.
practitioner, all right, from Femina Clinic. All right, so I don't want to waste any more time. So, Praha, what is premature ejaculation?
Okay, so premature ejaculation, by the name itself, it's basically ejaculating quicker or faster. There's two types of premature ejaculations, which is a primary or acquired.
Okay, let me hold you there. So when you say quicker or ejaculating quicker, right? Is there a time limit, or is it whatever the patient feels is too quick?
So by definition, primary PE, premature ejaculation, it means that once they have penetrated intravaginally, they ejaculate less than a minute.
Okay.
On the other hand, secondary premature ejaculations, once they have penetrated, they ejaculate within 3 minutes, lesser than that or up to 3 minutes.
Okay.
Yes.
All right. Fine. So, but you mentioned there's what, primary and secondary.
Secondary,
Okay.
right.
Can you explain?
So primary PE, it starts at the very first time when they become sexually active, whereas the secondary premature ejaculation it happens over time. So that's where they have bimodal discrepancy or occurrence
Distribution,
of PE, in which there's a lot of younger gentlemen when they're embarking on their sexual life, they face premature ejaculations. On the contrary, the older ones who had good sexual life for quite some time, and then suddenly they notice they develop premature ejaculation. So the distribution is bimodal.
Bimodal. So you would say a younger group of adults just starting on just starting on being sexually active can encounter premature ejaculation, like you mentioned.
Right.
Okay, so generally this is where I see a lot of patients coming from this group. Okay, so first one or two sexual encounters, and they feel that they ejaculate too quickly. Okay, and they think it's. I mean, of course, it's distressing to them.
Yes.
But equally so, I have seen older patients, gentlemen coming in as well, complaining of, doc, I've had good. I could last longer before this. I could satisfy my partner for longer, or I could engage in sexual intercourse for longer. But now I sort of tap out too fast, right?
Yes.
So so these are two groups that we've seen. I've also seen patients who had been having these issues from the time they became sexually active, and it worsens over time also. All right. So Vaishni, when it comes to premature ejaculation, how much does it affect the female partner? I mean, how much does it affect the partner from a female point of view? If the man has premature ejaculation, how does it affect women?
All right. So when it comes to sexual intercourse, when the guy has premature ejaculation, of course, from female points of view, she might not get into climax yet, and he gets into ejaculation. That makes some of the female get frustrated, or they feel like not dissatisfied. So it's depending on the female. Okay. So, but of course, it is somehow affecting for females' part actually. Yeah. But if let's say in a couple or marriage person, I would say female can be help a guy to handle these issues actually.
Okay. Fine. Because I see a lot of them who have premature ejaculation, and it is distressing to them, and it puts a strain on their sexual preference. I mean, their sexual life. So much so that they lose interest in their partners. They lose interest in the act itself. Some do seek help from us. Some have gone to the point of not wanting to have intercourse as well, where their confidence is broken. Okay, so Praha, is this a curable or a manageable or a treatable condition? And if so, what can be done?
So, Deeban, actually, this condition, it is manageable. However, it may not be completely curable per se.
Okay.
So patients have to learn to live with it at some point of time, but it also so much so that we emphasize on treating from doctor's point of view. They also need proper support from their partner as well, psychologically. So we go back to the roots of the PE, like either it is a psychological cause or could it be an acquired cause because of diabetes, hypertension, cholesterol issues? Could it be hormone issues? So those things has to be addressed as well.
Okay. And then treatment based on that. So if you can go into detail, like, okay, for example, a psychological cause of premature ejaculation, right? How would you go about discussing with the patient, and what are the treatment options you think would be suitable for the patient? Or what are the treatment options that is available to them?
Coming to psychological disorders, I think you also know it's very difficult to diagnose per se because there's no clear-cut evidence through the blood or diagnosis of exclusion. So we still screen them as we would to find out possible acquired cause and manage accordingly. But pertaining psychology per se, the treatment goes in a stepwise manner. First, we will address the sensitivity of the penis with numbing creams. And then second step would be increasing their serotonin levels in the brain, because that's responsible for their orgasm. So with some selective serotonin reuptake inhibitors like Prileges or Seroxat, even synthetic opioids like tramadol, but it creates dependency and dose tolerance eventually.
You mean to say dependency is from tramadol?
Tramadol, yes. Thirdly, we would put patients on certain supplements to make the penis tissue or the corpus harder and stronger. And lastly, pelvic floor function has to be strong as well. So we teach them certain exercises like Kegel, or they can opt for Kegel chair. So these are the ways to address this issue. And personal experience, I also face a lot of patients who are non-Muslims. They come with PE, but in those cases, yes, they attribute it to psychological issue, but it's actually a structural issue, because uncircumcised penis, as you know, it can lead to PE as well. But again, it's a surgical intervention. So which
not everyone goes for it. Not everyone goes for it.
It's a mode of treatment.
But it's a viable mode of treatment, yes. But again, I would think that there are options available, other options available, like you mentioned, numbing creams, which are safe. I think a lot of them have this innate fear of topical creams and all that, but it's not. It's perfectly safe. It's temporary. It just numbs the penis at that point of time. But learn from your medical practitioner on how to use it. Right, that's important.
Right,
and then of course, there's medications, SSRIs, and then there's also Kegel exercises, all viable options as well. Now, what about behavioral therapies, Vaishni? Is there anything that the patient, you think, is able to do to help themselves while having intercourse, or is there anything that the partner can assist in managing this?
Yes, of course. I think in this part, a female can assist the male partner or their anybody like who have like sexual intercourse with them. So have issues with the premature ejaculation. So what they can do, actually, they can start with sexual intercourse during or before the sexual intercourse by starting off with the masturbations, okay? Or when they start with during the intercourse, right? So the male need to proceed with the sexual intercourse, all right? So this is start first, and then they build up, okay? When they reach to climax, they need to stop. So the female will assist on that part to stop them to get climax, and this can control their ejaculation. So how it goes, actually, when they stop the ejaculation, they can recharge back. Okay, so they can recharge back, and they can repeat these moments for few times. This is in order for a exercise method on how to train with their ejaculation.
Okay, so this is known as what? Start technique, right?
Start technique.
So
yes,
my understanding is basically they get triggered by stimulation to the penis. So you engage in sexual intercourse up to the point where they're about to ejaculate or about to climax, and then either the person, I mean the man, or his partner stops stimulating the penis, basically stop having sexual intercourse until the feeling tides over, and then they resume. And they do this, again, this is my understanding of it. And then they resume this activity about 2 to 3 times during the whole period of sexual intercourse, and then finally the man is allowed to have intercourse.
Like a normal
orgasm
orgasm.
or climax. Yeah. So this sort of builds up their threshold for orgasm per se. I think another technique would be squeeze technique. Where it's the same thing, but instead of stopping sexual intercourse, this is where either the partner or the man himself squeezes the penis when he's about to when he's about to ejaculate, so that the feeling of ejaculation goes away, and then they do this 2 to 3 times during that process before actually ejaculating. So in the long run, this helps as well. Okay, but are there any other secondary causes for premature ejaculation, like that you might have encountered?
There is, Deeban. Usually it is a hormonal issue.
Okay.
Where when they have low testosterone, even on the other hand, high testosterone, they can have premature ejaculations, but this is acquired. Also, a very important cause is erectile dysfunction itself. PE, secondary PE or acquired PE over the years, it could be a tail sign that this person is going to have ED in the future, which a lot of people, like they in Malay we say tutup satu mata dulu.
All right, so because not recognizing.
Yes, statistically, it's quite staggering that globally, adult males who are sexually active, 30 to 40% of them actually face premature ejaculation. So a lot of people, come to us and they are so frustrated about it, don't know where to go. They try all sort of treatment, and this affects their self-confidence as well. So it takes time, but it's a long process, so they have to be patient as well.
So to add on to that, when I've seen cases of secondary premature ejaculation, so like you said, it could be due to hormonal imbalances, like low testosterone. It could be due to high estradiol as well. And then I've seen patients who have secondary PE due to just purely obesity and
lifestyle
issues like obesity, lack of exercise, sedentary lifestyle, and so on. So I think and when they actually do active lifestyle modification, they start losing weight, they start exercising a bit more, these symptoms tend to improve as well. So, and then also I've seen patients who, even diabetes for that matter, better diabetic control also is able to help with premature ejaculation and as well. All right. So, just a couple of things I want to go in before we end this episode today is, as usual, our rapid fire. Okay. So our research team has compiled some questions. Okay.
Let's go.
So, let's see what are the questions that they've compiled. Okay, so PE. First question: PE is always due to psychological causes.
False.
All right, fine. I think that we've explained that already.
Yes.
That there's a lot of other factors that are bringing about PE as well. All right, fine. PE only happens to. Okay, next question. PE only happens to younger males and not older males.
False.
All right, fine. I think you explained as bimodal distribution, younger and as well as older. All right. True or false? Kegel exercises can help a man manage his premature ejaculation.
I would say true.
Yeah. So it's in between actually.
Not entirely true, because you can't just do Kegel and expect you.
Correct. So I think like something that you need to be prepared on your psychological way.
Okay, so it's one of the things. One of the things that a man can do. All right, fine. Okay, so next. Okay, last question. Okay, PE is a permanent condition that is not treatable.
False.
All right, fine. I think we explained it quite well, that there are multiple options available. So every option, as usual, has its risks, has its benefits, has its suitability criteria. So there are patients who can do it, there are patients who can't do it, and so that again brings the importance that this topic should be discussed with their health practitioner, and of course to better empower them on managing their condition. All right. So I think that would be the most important take-home message, that PE is not something that you have to suffer in silence, that it is a manageable condition. You just need to be brave enough to talk about it to the people who know about it, so that something can be done about it. Right. So fine. So Praha, Vaishni, any other input, anything that you guys would like to add on?
I think I would emphasize that especially like premature ejaculations, unfortunately there's no magic bullet to it. But a lot of
I think a lot of patients come in hoping that there's a magic bullet.
which I would love to if there is one, but it's treatable, but it takes time. So be patient. It's a long process, and don't buy into the products that they sell out there online. So things like that. They say if you take this now, 2 weeks you're gonna perform.
Yeah. So it's always important to discuss with
there's
your
no
doctors.
shortcuts, but always discuss. Feel free to discuss with the medical practitioner. To talk about it, and then they can guide you. We can guide them as well. From head to toe. But trust the process. Trust in yourself. That's the most important thing.
All right. That's good. That's good. Very sound, good advice. Vaishni, anything else?
I think nothing much. I agree with Dr. Praha. What he said. Trust yourself. That's important thing actually.
So I think the other thing that I'd like to really add on is that this is again, premature ejaculation is something that affects the man and his confidence level, and so it's quite important for his partner to understand as well, to understand this condition. And of course, when because we've seen numerous times where it's the partner that brings the man in, right? So it's important to discuss these topics, discuss this with their partner, and be open about it, and be open to accepting management, accepting the fact that it is again treatable and it's not something to be ashamed of, right? So I think that in total brings to the end of this podcast. It's short but concise. All right. Thank you again, Vaishni and Praha. So it's good that we are able to discuss this topic so that this can empower a lot of men out there as well as their partners out there, that in regards to premature ejaculation and how this can actually be managed, treated, so that you don't have to suffer in silence. So having said that, always stay informed, stay healthy, and we'll see you in the next one.